This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details.
Hello and welcome to HealthLink, a program connecting home, community, and healthcare. My name is Carol Merton, and today I am delighted to welcome Adel Coulter, who is an infection control nurse at Public Health Grey Bruce. And Adel is here to fill us in on the safe disposal of prescription and over-the-counter medications. Adel, welcome to the program.
Thank you, Carol. Glad to be here.
Thanks. Just for our viewing audience, how long have you been in the role that you're doing currently with public health?
Oh, goodness. Now you're going to age me.
Oh, no.
I've been with public health for 10 years now, working within the infectious disease team. And then currently my role is within the both Grey Bruce Public Health Infectious Disease, but also an IPAC role, so infection prevention and control. And I also, most of my time is actually dedicated to the Grey Bruce IPAC Hub, which supports our congregate living organizations in Grey Bruce in terms of infection control.
Excellent. I call that experience and expertise, not aging.
Fair enough. Fair enough.
So thank you for sending me the information and also for the questions. And so we'll just roll through those questions and feel free to add information. I may have questions as a result of our conversation as well. So the very first bullet point that you had sent to me was, why is the improper disposal of prescription and non-prescription medications a concern?
Well, the concern to it is three different areas, I would say, is public safety, environmental impact, and legal implications. Sorry. So public safety in terms of medications getting into the wrong hands when thrown in the garbage can or left in cabinets too long. The environmental impact actually is harmful to the environment, whether it be our landfill or flushing down of the toilet or, getting into our water system from that perspective. And then on the legal aspect of things is that, oftentimes our prescription medications actually have personal information on it, given our name. The prescription label has your name. It also has where you pick up your prescriptions, whether there's a renewal available on that prescription. So those are the things that we're concerned about with regards to the disposal of those.
And they're important points for sure. So let's dig into them even deeper.
Sure.
So let's talk first about medications getting into the wrong hands. And you sent me a link, which I found absolutely fascinating. So I did pull up some of the link information, but tell us a little bit more about getting in the wrong hands and why that is so important.
So obviously medications being obtained by unauthorized persons or people that shouldn't have them can use them in an illegal aspect of things, depending on the medication. So obviously if it's an opioid or whatnot and getting into the wrong hands, that can be an aspect from that point of view. We do see that trends indicate that rising rates of recreational misuse of prescription drugs by youth. Majority of them are actually obtaining them from family medicine cabinets or from family friends or friends that are obtaining them from that aspect of things, aside from other methods in which they're obtaining them.
So that definitely is a concern as well. And you mentioned about young adults. So this is a trend. You're tracking it statistically and you're seeing a change.
Yes. Yeah. So I think statistically you're seeing some changes that way.
So around the environment, and again, I really liked one of the articles I pulled up. It says, "Don't flush. Why drug disposal method matters." So tell me why I shouldn't flush.
For sure. I will say that it's important to note that in terms of our drinking water in Grey and Bruce, 65% of our drinking water are actually like well systems. They're not actually municipal systems. So in terms of where you're flushing those meds will also indicate where that might be going. So in terms of water contamination, so that if you're flushing meds, it's going to go to the water treatment plant. And obviously water treatment plants can, take out most things, but they're not going to be able to take out everything. So it's important to kind of look at that. So the significant use of that product and or flushing and or whatnot from that perspective can increase the amount in our drinking water, which then can translate into the food chain. So in terms of fish, our animals that consume them, those sorts of things. And wastewater systems are just not capable of completely removing all pharmaceutical residues from entering that water supply. The other aspect to that is that there's the accumulation of, say, antibiotic resistance could actually happen. So if you think about flushing those and getting into the water system and then into the animals and whatnot from that perspective, it can build resistance amongst the use of some of those antibiotics for future kind of things. The other aspect to thinking about it getting into water systems is that it's generally could be through flushing or pouring down the drain, of course. But the other thing is human elimination. So regardless if you're eliminating those drugs through your own feces and urine, that's also going to the water treatment plant that then is also circulating through. So they do have methods of cleaning and whatnot from that perspective in terms of the water system, but it's just important to know that.
The issue around the environment was a learning for me because, I understood about the water systems and that, but it didn't occur to me that the environment is at risk as well when pharmaceuticals are flushed or even thrown in the trash. Because in landfill sites, they can leach out as well. Am I correct in that?
Exactly. Yes.
And so it harms our wildlife, but it also affects their reproductive ability as well. See, I did read that link. So, it's not just good for humans, it's good for our wildlife as well to ensure that we have the appropriate disposal as well. Are some opioids more toxic than others? Is there a degree of impact in our environment, or are they all pretty nasty?
I can't really speak to that, Carol. I really don't know the degree of toxicity in terms of what it might do to the environment, but certainly toxicity is different among whatever medication we're using and or the dose of which. So that would make sense to me, but I don't have any specific information on that.
So I'm wondering if we can chat a little bit more about medicine cabinets and how sometimes people will stockpile medications. And I may not be going in quite the sequence you gave me, but I am able to cycle back.
That's okay. No worries. I think, that we all have medicine cabinets.
Yes. And they're not all locked either.
That is correct. But certainly want to look at medicine cabinets in several different aspects. One, as you mentioned, locked. Making sure medicine cabinets are out of reach of children and or have a locking mechanism is extremely important. If someone is using, say, any kind of narcotic or opioid or anything like that is of a higher degree of concern, you may even want to have it in further lockbox in order to make sure it doesn't get into the wrong hands. And in terms of our medicine cabinets, I have a young child, so of course we always make sure we keep a little bit of, say, Tylenol or Advil or fever reducing medications on hand, but you don't always use it. So, and it could expire. So you could have quite a supply of medicines in your cabinet that expire. And then what do you do with them? So I know for myself, I package it all up and I drop it off at my local pharmacy, which is important. But we also can look at some of our prescription pharmaceuticals, not just our over-the-counter pharmaceuticals, but our prescription pharmaceuticals that, have been prescribed by your healthcare provider, and you may or may not have taken all of them, and you have a little bit of a stash left in that medicine cabinet. And some people may have that for years before they dispose of them. And of course, that could also increase the risk of someone inadvertently taking an expired or unused prescription that's no longer effective, or could be more than effective for that matter, in terms of it becoming a dangerous danger potential in your family if they were to get a hold of those, and or if you were to take a med that maybe you had an allergic reaction to something, and you still stored them up in the cabinet, and then you grabbed that by accident and you took it. So the dangers around making sure that we review our medicine cabinets and discard of those medicines when they expire or if they're not being used is really important.
You mentioned about having young children, and we talked about young adults obtaining prescription medication, but it is also a poisoning risk to young children by not disposing of the pharmaceuticals. Wondering if you wanted to speak briefly to that.
No, I think that's exactly, kind of the key there is, one, having medications located in a way that they're not accessible to children. So they're at a higher level that they can't reach them, and or making sure they can't easily open that door. Can that door be locked so that they can't access that medication accidentally? From that point of view, if they were to take it, it could be certainly very dangerous to their health. So making sure, however we're storing our medications, that they're stored in a manner that they're out of reach of children is really important. And then, of course, the locking mechanism, if at all possible, to make sure that that's in place as well.
Nowadays, we hear many people having concerns if they don't have access to a physician or someone who can assist them with prescribing medication. And my thought might be that they might be tempted at that point to keep any medication that they have because they just don't know if they're going to be able to get it renewed. And some choose not, they have concerns about going to ER for a variety of reasons. It could be wait times, it could be the risk of infection. That is becoming more of an issue about physician availability in our community. Your advice to people around that still would be, if your prescription, if you're over your need for it, to dispose of it.
Yes, that's definitely the recommendation, is still to dispose of it when you're no longer in need of it, and or expired. So if that prescription has ended and you shouldn't be taking it any longer, then it needs to be disposed of properly. I know that, locally or rurally, it's difficult to get a physician in some cases. And, there are the emergency rooms and whatnot from that perspective. But now there's also the ability for pharmacists in some regards to do some prescribing. So, I think it's as much as it's probably not easy, but just reaching out to find those different avenues in order to get prescription renewals is important from that aspect, and or getting your name on a list to get a physician when one does come available.
Now, you mentioned that you bundle yours up and you take it to a pharmacy for disposal. Are there other ways that people can safely dispose of medication other than pharmacies?
So ideally, that's where you would take them, is your local pharmacy. So you would bundle them up in a bag and take it to them. You could remove I guess if you're taking it to the pharmacy, that's a different avenue in terms of disposing of packaging and things like that. But take them to your pharmacy in a bag and they'll dispose of them appropriately in terms of medication. So liquids or pills or capsules, those sorts of things. Just put them all in a bag and take them to your local pharmacy. It's a take back program in Ontario, so all pharmacies should be able to help you in terms of taking those back. I'm not aware of any upcoming take back programs in terms of, I think there has been some in the past led by other organizations to do med drop-off, like similar to your hazardous waste, but I haven't heard anything in the near future locally. But those sometimes do happen, but ultimately, any pharmacy, it doesn't even have to be the pharmacy you deal with. If you package them all up and take them to them, they will ensure they're disposed of appropriately.
And that's at no cost to the public.
That is correct. It's no cost. No cost. Yeah.
So I know in the information that you provided, you also referenced about seniors and the risk of taking expired medications. And I'm wondering if you could comment a little bit more about that, and does that put them at more risk? And what advice would you give to those who are seniors or those who are caring for seniors?
For sure. obviously, double checking what you're taking is really important in terms of before you actually take it. If it's expired, chances are that medication is probably less effective than it was when it was in good date. However, that might then have implications on how well it works within your system. So just really making sure that you're looking at your prescriptions closely. If you're helping a family member, just watching those expiry dates. In some cases, you can actually get those little sets where you actually put all of the meds in at specific days and times, and then it's easy. It's just, okay, this is Monday, we're going to open up, take Monday, or Monday evening or Monday morning, whatever.
Yeah.
So that is one thing that you could do to help your families. If you're supporting a senior, is you could fill out a dosette so they don't have to look at the actual packaging, because the writing on that packaging can be quite small. Even I feel that way. So in terms of that, or on the other side of that, if you're using the bottles and you are a senior, you might want to have a magnifying glass around so that you can actually check those expiration dates from that side of things. And if at any time you have questions, please make sure you reach out to your local pharmacist. They're more than happy to answer your questions and or support you in getting a renewal, whether they have to reach out to your physician or it's something that they can do. That's where I would recommend that you go with that.
And certainly, shout out to all the pharmacists, because honestly, they are such an expert resource. And like you say, more than willing to assist. They just are excellent at helping the public and their role is expanding, as you discussed a little bit earlier as well. I'd like to go back to the personal information, because as you were talking, it puts people at a risk for identity theft. And we're hearing more and more and more about identity theft and those risks, as well as, you don't necessarily want people to know your personal health information by what you're taking. So those pill bottles, those labels stick on like crazy, and they're hard to get off. I know, because I've tried. Would you suggest using a black magic marker or something that can just, and the same for the dosettes, some of the packages actually have the listing of the person's name on the top. So just throwing out that plastic container after it's emptied may not be quite enough. Can you speak a little bit about health information security?
For sure. So yes, our bottles or our prescriptions often have our name on them, as well as the pharmacy in which you got them. And they will even have refill information on them. So if that bottle were to get into the wrong hands, it does pose a potential for someone to try and refill that prescription somewhere else. Under your name, but being a different person. So, even using a Sharpie or whatnot to cross off your name and the information on it is important if you're disposing of it in the garbage. However, if you're taking it to the pharmacy, they will dispose of it accordingly. The packages that you talk about, Carol, I believe are those dosettes. So oftentimes there may be an ability to remove the top half, in which case, you could cut it up into multiple little squares so it's not easily read. From that point of view, or if you have a shredder, provided there's not any extra plastic on that part of it, just drop it in the shredder and away you go from that perspective.
Yeah. So basically, before we move on to the issue around sharps and syringes and safe disposal of those, really the messaging is, don't flush things down the sink. Don't flush things down the toilet. Gather it up and take it to your pharmacy and keep an eye on the dates. It's sort of like food products. It's a best before, and you wouldn't have in the same concept for medications, right? Best before.
Exactly. Yeah. Best before dates. Exactly. And exactly. Take it to the pharmacy and they will handle it accordingly.
Perfect. How would you advise me or any members of the public about safe syringe disposal? And I'm going to ask you, as part of that, more and more people are engaging in community garbage pickups and, wanting to help our environment can sometimes come across syringes. So I'm wondering if you would mind. I know that's not on your information, but that's my added question.
That's okay. So two different avenues here. So one, we'll talk about safe disposal within your own household for medications that are prescribed to you that are administered by injection. Your local pharmacy should be able to provide you with a sharps disposal kit or a sharps disposal container. It's a plastic container. Generally, they're yellow, and you would put your sharps in that. And when it becomes full, you would take it back to the pharmacy for them to dispose of appropriately. With that said, if you don't have a sharps container within your home, you can still dispose of them safely. What you're wanting to do is get some form of a hard plastic container and put them in that, so that it's not going to have risk for poking you or anything from that perspective, or someone else if they're taking it to the pharmacy. One thing to add is that when you get to the pharmacy might ask you if it's your needles or whatnot from that perspective. They may ask you to then transfer it into their appropriate container. That's a possibility. Or they may just drop the whole container right into a big bucket. So it will depend on the pharmacy and what their practices are, but ultimately they will still assist you in disposing of those correctly. We do ask that you never dispose of your sharps containers in the local landfill or garbage. That poses a risk to our environmental staff that work and pick up our garbage in terms of sharps injuries, and we don't want that to happen. Sharps injuries obviously can then could cause potential for transmission of blood or bodily fluids, or in terms of infection. So we don't want to pass something on from our bodies to our environmental staff that are picking up our trash. So don't do it that way.
Yeah, that's an absolute no-no.
Absolute no-no.
So the sharps containers are supplied by the pharmacy. Is that how that happens?
Yes, that is correct. They are supplied by the pharmacy in terms of being able to get rid of things. So if you're diabetic and take insulin or any other kind of medications, they are supplied so that you should be able to dispose of them effectively.
One of the things that I have noticed is more and more in public buildings, whether they're municipal owned or other there are sharps containers that are now available in the washrooms, which seems to be more and more. So it certainly provides the opportunity for safe disposal of sharps. When people are out and traveling or whatever, they still need to take their medications.
Correct.
Yeah, so it's interesting. I'm seeing more and more of those as I'm out and about. What about sharps that you find not in home environments?
For sure. So that is probably the larger concern in terms of, as you mentioned, I've certainly seen over the last couple of weeks, lots of people along the roadside, certainly on Earth Day, cleaning up the roadsides and whatnot from that perspective. So I think if you're planning an activity, so I'll look at it two different ways. One, if you're planning an activity to clean up the roadside or clean up the park or wherever you might be, then I would encourage you to, one, have a plastic bucket. And wear gloves when you're doing such an activity. And then I would actually encourage you to even have a set of tongs with you. So if you do come across any kind of a needle or sharp that needs to be disposed of, it can be picked up using those tongs and not touched directly, and then disposed of in a plastic tub. So that is how I would recommend doing that. If you were to come across a large quantity of needles that have been dumped somewhere, hopefully that doesn't happen. Certainly you could call the municipality and they would come and dispose of those accordingly.
So those sharps that are found not within a home environment can be returned to a pharmacy as well. Is that correct?
Yeah, I would say that they could. If it's it could also come to public health, and I'm sure that we could dispose of them as well through our harm reduction disposal side of things.
Okay, that's really good to know, because people may not realize a substance or product that could be potentially quite harmful could be on that syringe or even any of the paraphernalia that's around.
Correct.
So,
Yeah. Yeah. So just really making sure you're extra cautious with glove use, having and being prepared in terms of tongs or those, I guess tongs is probably the easiest way to put it. But you can often pick up little grippers at the dollar store or whatnot. So if you're going to do any kind of participation that way, just making sure that you're prepared so that you're not going to potentially harm yourself while doing such a great deed at helping our environment kind of thing.
One of having participated just recently with a group that was picking up, one of the pieces of advice was wear appropriate footwear. You want to make sure that your feet are protected when you're out and about, because who knows what you might find.
For sure. That's a good point, Carol. Don't wear your flip-flops when picking up sharps. That's not a good idea.
Yeah. We have about 3 minutes left in the program, and I'm wondering if you'd like to profile something we haven't quite covered yet. We haven't talked about the Health Products Stewardship Association, but I didn't want to assume that you wanted to take the time for that. It's up to you.
I will have to say that I don't know a whole lot about it in terms of prescription drug use and all of those sorts of that are the disposal aspect of things. That I would say that if anybody has any questions with regards to disposal of any of their prescriptions and or sharps in terms of their personal use, that you reach out to your pharmacy. That is the go-to in terms of the subject matter expert, I guess you could say, in terms of getting that information.
So we do, as we mentioned earlier, have people who take care of people who may have to also, dispose of medications or sharps. Is there anything else or any other products through IPAC that you want people to be aware of, to be cautious about?
I don't think so in terms of this discussion anyways, but always making sure that depending on who you're caring for and what you're doing, you're going to want to make sure that you have the appropriate protective wear in terms of what you're doing. So gloves are something that's really quite important to have around depending on what you're doing. When you're disposing of different things and or if you come into contact with something, especially if it could have potential to have contact with blood or bodily fluids. So those are some of that would probably be one of the big things that I would say to make sure have on hand, and or making sure that depending on what it is that you're doing, you may want a gown for that matter, or an ability to change your clothes. Certainly not in the prescription medication aspect of things, but in terms of if you're helping your loved one with other tasks and things like that, just looking at it from that lens, from an infection control point of view.
For sure. So in one of the articles that I read, this line speaks, I think, summarizes beautifully what you've been saying. Improving disposal practices could significantly decrease the rates of misuse associated with both prescription and illicit opioids. That's a powerful statement. I want to thank you so much for being on this program. The information I know I learned from, for sure, when I did the reading, and certainly encourage people to investigate further. If they have questions, they could connect with the health unit as well.
They could, but I would really strongly encourage them to connect with their pharmacy directly.
Yes.
Because they're the ones that are doing the disposal and whatnot from that side of things.
Excellent work. Thank you for all that you're doing to keep our community safe and for sharing this information with us today. Really, really appreciate your time.
Thank you for the opportunity.
Thank you to our viewing audience for joining us today on HealthLink. We look forward to further programs that advise you and your family of resources and services available to you and to our community.
Call the Rogers TV Viewer Response Line. Email us or connect with us on social media.
Are you the type who would keep going or stop? It's not easy to stop when you have an addiction. Legalizing cannabis won't stop addiction. It trivializes its consumption. Let's be vigilant. If you need help, visit portage.ca.
And he fell.
Whoa, I'm not driving. I'm way too stoned. How are you feeling, beer?
Since we had that talk, I'm not driving tonight.